What is sildenafil and how to take it? Sildenafil, commonly known as Viagra, is a medication used to treat erectile dysfunction by increasing blood flow to the penis, helping achieve an erection during sexual stimulation. It is also prescribed for pulmonary hypertension. Sildenafil works by enhancing blood flow to the penis during sexual stimulation, which helps achieve and maintain an erection. How to take it? Dosage. Generally, a dose of 50 mg is recommended 1 hour before sexual activity, but this can be adjusted to 25 to 100 mg depending on effectiveness and tolerance. Frequency. Do not take more than 1 dose per day. Precautions. Intake. It can be taken with or without food, but fatty meals may delay its effects. Consult your doctor before using sildenafil if you have heart conditions, liver or kidney problems. Avoid consuming it with alcohol or medications like nitrates, as it may cause dangerous interactions. Side effects. Common side effects include headaches, facial flushing, blurred vision, or dizziness. If you experience a prolonged or painful erection lasting more than 4 hours, seek immediate medical attention. Frequently asked questions about sildenafil. Is sildenafil safe? In general, sildenafil is safe when used as prescribed by a doctor. However, it is not suitable for everyone. People taking nitrate medications for heart conditions or those with severe health problems like liver or kidney issues should avoid it. It's essential to consult a healthcare professional before using sildenafil to ensure it's safe for you. How long does it take for sildenafil to work? Sildenafil usually starts working within 30 minutes to 1 hour after taking it. For best results, it's recommended to take it on an empty stomach, as a heavy meal may delay its absorption. The effects of the medication can last for 4 to 5 hours. How often can sildenafil be taken in a day? Sildenafil should not be taken more than once per day. Taking more than the recommended dose increases the risk of serious side effects, such as low blood pressure, dizziness, or priapism, a prolonged and painful erection. What are the common side effects of sildenafil? Common side effects include headaches, facial flushing, nasal congestion, dizziness, and upset stomach. In rare cases, it may cause blurred vision or vision loss, or a prolonged erection, priapism. If you experience any of these side effects, it's important to consult a doctor. Can alcohol be consumed while taking sildenafil? It is advisable to avoid or limit alcohol consumption while taking sildenafil. Alcohol can reduce the effectiveness of the medication and increase the risk of side effects such as dizziness or a drop in blood pressure. Does sildenafil affect fertility? Sildenafil has not been shown to directly impact male fertility. Its primary function is to improve erectile function, but it does not affect sperm production or quality. Is sildenafil covered by health insurance? Sildenafil coverage can vary depending on your insurance plan. Some plans may cover part or all of the cost if prescribed for erectile dysfunction or pulmonary hypertension. It's important to check with your insurance provider to confirm coverage. If you have more questions or concerns about using sildenafil, it is always recommended to consult your doctor or pharmacist for personalized advice. If you found this information useful and want to stay up to date on the latest in prostate health and wellness, don't miss out. Subscribe to Prostate Patrol today. Click the subscribe button now and become part of the Prostate Patrol community. Together, we can take proactive steps to improve men's health.